Uh, my job is a little simpler because my previous speaker has already spoken a lot about the management part. But still, there are some nuances in pediatrics or in children, so I'll dwell upon them and also talk about preventive part a little bit more. So, as the heat-related illnesses in children, so I'll be covering basically under three heads. One is preparedness in schools, where the children will be going during daytime. So it is important that school authorities are aware about the problems and prevention of it. Then awareness in parents and children, they themselves have to know the problems and to prevent the complications or anticipated issues regarding health related heat related problems and management of heat related illnesses as such. So in preparedness of school, the most important thing is potable water. So whether it is a village setup or town, city, I mean, there has to be availability and accessibility to potable water. This is a must. Water coolers need to be clean because this is the time when often the coolers may not have been cleaned for long, and it there has to be ensured that regular cleaning and monitoring is being done. Um, Classroom should be well ventilated, goes without saying that ventilation is must, cross ventilation rather, and there should be enough ceiling fans or AC as the case may be. There should be backup electricity to be ensured during class hours because it may so happen that during peak summer the electricity is gone, so there has to be backup electricity. And avoid plastic water bottles. Then school timings, it should start early and close before the peak temperature. Generally, the peak temperature between 12 to 3, and the school authorities should be mindful that you start early and you close also early. Flexibility of games and sports period based on temperature and humidity factor. And as we know that humidity factor is a very important factor, like in coastal areas, the temperature even 37 degrees is very high, and in plains it is 40. So humidity adds on to the problem. So this also needs to be seen. No major outdoor sports events should happen during the summer months, and that too during the daytime, that is between 12 to 3, that should be avoided. And if at all, the events can take place in indoors and not outdoors. There's some problem in the slides. It's not moving. Yeah. Clothing should be comfortable, loose, lightweight, and light colored. And as far as possible, neckties should be avoided. And as I said, strict adherence to summer holidays and flexibility to prepone or postpone if the need be. I mean, if the temperature changes suddenly or there is suddenly heat waves coming up, then there should be flexibility in the hand of the administration to change the summer holidays. Now, what about children like going for sports activity? Anything special in that? I think it was also mentioned by the previous speaker that once somebody is coming from a cooler climate to hotter climate, there should be acclimatization because they are at higher risk. So maybe when they if the children have come from a cooler climate, so they should be should not move out in the open for about a week and then acclimatize gradually in warm weather and increase their activity over next 1 or 2 weeks. They should remain well hydrated before, during, and after physical exertion. Very, very important. Then there should be some mechanism to screen for any health condition or medications that may predispose to heat-related illnesses, and particularly watch for fever or gastrointestinal illnesses. Why so? Because once fever is there, that child is even more prone for dehydration or heat-related problems. And also gastrointestinal illnesses, like if somebody is having diarrhea, is also again at more risk of going into dehydration. Similarly, drugs like beta blockers and Lasix and this kind of medicines or cardiac medicines, your sympathomimetics, anticholinergics, so all of them will be putting child at risk of more dehydration or heat-related problems. Children should wear light colored garments, and as I said, and that should be lightweight, loose fitting, and then Even it should be seen that the uniforms and practice gear should be made from open weave or sweat wicking materials to facilitate evaporative heat loss. And when the weather is extremely hot, then practices should be scheduled for mornings and evenings only when the temperature is generally cooler. So if one figure one needs to remember, probably 12 to 3 is the time when there should not be, sports activities during this time. Now, what should the students should know? So they should be encouraged to drink water by teaching the beneficial effects of drinking water, and also water with added minerals, as heavy sweating will remove the salt from the body that need to be replaced. Now, children should know that you should not drink only when you are thirsty, you should drink beforehand. That is the catch. I mean, they should be taught in such a way that you have to be well hydrated during summer. So please drink water even if you are not feeling very thirsty. Avoid fruit juices, sugary drinks, or carbonated drinks as substitute of water, because these days people feel that carbonated drinks are okay. They are also liquids and they have some water. No, I mean, they should be avoided. And our Indian traditional shikanji or Indian lemonade, ampanna, bel sarbat, these are okay. Then teach children importance of bathing each day to prevent skin infections, because these also are very common now during summer. And never leave children in a parked car, even if the windows are open. And if possible, wear sunscreens, broad spectrum ones, and also use umbrella or hat once outside shades more than normally done. Now, they should be also be aware of early signs of dehydration. The children should know, the teachers should know, the parents should know. Now, what are these? These are like feeling faint, extreme tiredness, more than usual tiredness, intense thirst, fever, because fever can be a sign of infection also, bacterial, viral, whatever, or even hyperpyrexia because of hyperthermia or because of heat also. Headache, nausea, vomiting, not passing urine for hours or passing concentrated urine. I'll show you a good diagram how to know that, the more the urine is concentrated, the more the child is dehydrated. Breathing faster or deeper than normal, skin numbness, muscle cramps, dry tongue, or sunken eyes. So any of them you see, even the students or the children, if they feel or the teachers see, they are all early signs of dehydration. This is what I was telling, that urine color also says a lot. Now, if you look at the urine color, this is taken from Australia government website, like the first 1 and 2, like they're clear urine. Okay, so the child is hydrated. And if the urine color is between 3 to 4, that means it's mildly dehydrated. So drink a glass of water now. So that should be the message. If the color is between 5 or 6, that means, it's an indication that you are really dehydrated. So drink 2 to 3 glasses of water now. And if the color of urine is between 7 and 8, that means you're very dehydrated. Drink a large bottle of water. So this kind of pictures can be pasted on the bathrooms or places where they go for urination. And the students also can see, okay, my urine color is like this, so probably I should drink more water. So very easy method, but very effective. So now I come to the heat-related illnesses in pediatric age group, and there can be many already, mentioned by my previous speaker, and they can be right from, benign ones like heat rash, excessive irritability and dehydration, heat edema, then heat cramps, heat syncope, heat tetany, heat exhaustion, and the worst of all is heat stroke. So now, just knowing about the conditions is not good enough. We should be able to pinpoint that it is because of this. So like if it is heat rash or prickly heat or miliaria, so cardinal features will be itchy rash with small red bumps. And it is seen in the setting of heat exposure, of course. And the color will be like diffuse red color, and skin or vesicular rash will be there. There will be the cardinal signs. So what will be the negative findings? Like it will not be focally distributed. Like if it is focally distributed, then it is contact dermatitis. A very simple clinical message. Now coming to heat cramps. So painful spasms of large and frequently used muscle groups, that is what is heat cramps, and the child will be uncomfortable, and there will be difficulty in fully extending affected limbs or joints. But you should make sure that there is no contaminated wounds or tetanus exposure or no seizure activity, because these are the closed DTs. Then come to heat exhaustion. If the child is feeling overheated, lightheaded, exhausted, weak, steady, feeling of vomiting, child is sweaty and thirsty, unable to continue activities, it is heat exhaustion. How will the child look like? They will be sweaty, plus skin, hot skin, normal core temperature maybe, but then the child will be dazed, there will be generalized weakness and slight disorientation. Slight disorientation, not great CNS features. What you should ensure that there is no coincidental signs and symptoms of infection, because as I said, infection will also cause fever or high temperature. No focal weakness, no difficulty in swallowing food or speech, and no drug or overdose history. Coming to heat syncope, that is feeling of hot and weak, lightheadedness followed by a brief loss of consciousness. It will be brief, generalized loss of consciousness in a hot setting, and short period if disorientation, if at all it is there. But what you need to ensure that there is no seizure activity, there is no loss of bowel or bladder continence, because that will indicate towards seizures. No focal weakness or no difficulty in swallowing of speech. Now, heat stroke is the worst one, and it is severe overheating where the temperature will go beyond 104 Fahrenheit or 40 degrees centigrade. There will be profound weakness and there will be disorientation. CNS features will be marked here. The child will not be alert. There will be other. The child will be flushed. It will be dry skin. Core temperature will be more than 40 or more than 104. There will be altered mental status with disorientation. The child may be in coma, convulsions. The child will have tachycardia, may or may not have hypotension. So here also you need to rule out co-associated or alternate cause of this, that is when some signs and symptoms of infection, any focal weakness, and any drug or overdose history, or any difficulty in swallowing or speech. So this is some very simple clinical clues to diagnose these clinical entities, and also what you need to ensure, the negative history. Now I come to the simple management part and the prevention part. So for prickly heat or heat rash, the treatment is place the child in a cool environment, remove any excess clothing, and avoid application of lotions as far as possible. Prevention is using of loose fitting clothing or removing excess cloth, avoid direct sunlight, avoid excessive heat. And if the child is, a small one, a breastfed one, then frequent breastfeeding. If it is in the breastfeeding age group, that is in 6 months, newborn to 6 months. Next is excessive irritability and dehydration. Again, what you should do is placing in a cool environment, remove excess of fluids. Heat edema, which is more common in adults, by the way, where swelling of feet or ankles will take place because of local vasodilatation there. The treatment again is removed from the hot environment, placed in a cool environment, and elevate the affected extremity. That should suffice generally. No drugs are required. Heat cramps, it's common in young athletes. It's a painful one, involuntary spontaneous contraction of muscle groups of legs, calf, groin, and there's difficulty in extending that part. The treatment again is remove from hot environment and rehydrate. Frequent oral fluid should be given. If persists, then IV fluid also may be required, and addition of salt in water will also help in this condition. Coming to heat syncope, it is seen with prolonged standing in hot environments that causes vasodilatation and so fall in blood pressure due to venous pooling in the legs. And this will cause decrease in venous return to the heart, causing a fall in cardiac output, and all of them will result in fainting or feeling lightheaded. What you should do, remove the child immediately from the hot environment. Oral dehydration solution with salt containing fluids, as I said, like ORS, lassi, nimbu pani, lime water with salt and sugar, rice water, dal water, even coconut water, sattu, in anything, but some salt has to be there. So this helps. In heat tetany, it is differentiated from heat cramps by the fact that there is very little pain or cramps in the muscle, but that picture was also shown of tetany by the previous speaker. Again, you remove the child from a hot environment, calm the child to decrease hyperventilation, because hyperventilation is causing this problem, and intravenous calcium also will help once the child is admitted. Now coming to heat exhaustion, as I said, after prolonged heat exposure, the body temperature will rise up to 104, not go beyond 104, and it will lead to dehydration, tachycardia, vomiting, fatigue, and headache with normal mental status. The treatment would be again removing the child from the hot environment, oral dehydration with salt containing fluid, look for any dyselectrolytemia, intensive care monitoring, and IV